Um, Welcome to PSO 101, Practical Support Organizations. And I'm Leah Auden. I am the chair of the Reproductive Freedom Task Force for the League of Women Voters in Colorado. And we as a group decided that we would really love to present this panel of experts on this topic because, we have some great laws in Colorado. We even have a constitutional amendment that protects abortion rights. However, that doesn't mean everything is accessible to everybody or that abortion is necessarily accessible. In fact, it's not accessible for a lot of people and remains so, even though we have a constitutional amendment. And if anybody wants to get into the legal nitpicking, let me know. I'd be happy to do that and answer questions about it. It's been an education for me to learn just how things work with legislation and constitutional amendments. So we brought together this panel of the largest and most well-known PSOs in Colorado that have really risen to the occasion ever since Dobbs was brought up by our United States Supreme Court and changed the landscape of how things work with regard to abortion care. And I want to introduce them now to you in no particular order of anything. We have from Planned Parenthood of the Rocky Mountains, Kelsey Pickney. She's the manager of patient navigation at Planned Parenthood, excuse me. And this is a relatively new program, although I think it existed in other formats possibly before, but it's about 4 years old in response to the pressure that has been building and has been created by changes in the law, both federally and statewise in various states. We also have Gina Martinez Valentin, who's the executive director of the Colorado Doula Project, which when I first started doing this activist work, had no idea such a thing existed. It's a wonderful organization that provides typical PSO type funding and assistance and resources. And also it has a large volunteer component of people who help abortion patients sort of through the process. So that's a little bit different than some of the other places. Sierra Pierce is an intake manager with Cobalt Advocates, which also is a PSO and a advocacy group for abortion rights in Colorado. A pretty large organization that deals with probably a fairly large population of people. We'll have her talk about that a little bit more. And then last but not least, and something that's brand new to me, is Toshika Langford. She's the co-founder of an organization called With Gloria. And I'll let her tell a little bit about it, but in her efforts and people that she works with in this organization, their efforts are directed towards getting free lodging for people who need someplace to stay when they come, usually to the Denver metro area to seek abortion care. And it's a fairly new organization. It's run through a lot of technical stuff that we don't need to get into, but it sounds fantastic when I hear about it. So she's going to tell us how she helps out in this effort to make abortion accessible to everybody. And just as kind of housekeeping matters, if you have questions, please put them in the chat. We will try to get to them, especially if it's something that you just need to have clarified in the moment. Happy to do that. Also, we will try and set aside some time for questions at the end of the presentation, so we'll be able to do that. Additionally, if you're just fascinated by this slideshow and the information in it and think it could be useful to you in some way, if you will put your email address in the chat, I will email it out to you. Additionally, last but not least, housekeeping wise, this is being recorded. It will be posted on our what is the YouTube page available for folks. So if you have somebody you'd like to share it with who couldn't be here tonight, that's another great thing that's coming along too. I just want to give you a few little statistics and facts. I'm a retired trial lawyer, and this is what we in my business call evidence. And that's how we win cases, is with evidence. The United Nations Population Fund, in conjunction with the Center for Reproductive Rights, which is a standalone nonprofit, has determined that there are currently 24 countries in the world who have completely prohibited abortion. Andorra, Malta, El Salvador, Senegal, the Philippines, Laos are to name a few. And here's the alarming part, parts of the United States where abortion is effectively not available and is completely banned. To these two organizations, this creates a humanitarian crisis, which in my mind, and probably in the minds of a lot of people, I never thought I'd see that happen, that we would have a humanitarian crisis in the United States, but we do. Just a few facts about who needs abortion care in the United States. 1 in 4 women that we can document will have an abortion by the age of 45. The true statistic is probably more like 1 in 3. But there's a lot of underreporting of abortion care. 75% identify as poor or low income. So disproportionately, any of these bans and restrictions and inaccessibility issues always impact the people who are most vulnerable and least able to surmount the barriers to abortion care. Something that I found really interesting is almost 60% have 1 or more children already. And 51% have used a contraceptive method in the last month before they became pregnant. So that old saw that, people are using abortion as birth control just is a fallacy. They're using birth control and it's failing them. So I like folks to know that. How is abortion care paid for? And this comes from the Guttmacher Institute or the Guttmacher Institute, depending on how you pronounce it. It's not paid by insurance by and large. 50% or more pay out of their pockets for abortion care. In Colorado, that percentage is even higher probably, although I don't have statistics on that. Medicaid is the second most common method of payment, used by 30% of the people obtaining abortions. Only 13% of people use private insurance to pay for abortion because of insurance companies being profit-motivated entities. If they can see a way not to pay for something, they will do that. Now in Colorado, we have a new law that mandates that private insurance companies have to pay for abortions. There's a couple of exceptions to that, but we at least have some law now. 15%, and that's why we have these PSOs, relied on financial assistance from some other source, like Cobalt, Planned Parenthood, Colorado Doula Project, or the Gloria app. So a lot of people have to rely on other things for their abortion care expenses. Just so you have it, if you want, I will send this to you in the slides. These are the websites for all of our speakers organizations. Honestly, if you just Google them, you don't have to have the website. It'll take you right to it. So does anybody have any quick questions about these little statistical things that I rolled out for you? It's just kind of to support and bolster what our panelists have to say. So I'm going to stop sharing and then work on our, start with our panelists. We're going to talk about 3 basic questions and have all of them weigh in on those questions. The first one is, tell us a little bit about what you do, what the organization is, how it works. And we're starting by alphabetically with Sierra Pierce from Cobalt. She is has been working there a while, and she's a manager there. So I'm going to start with her and let her tell us what's going on out there and how do you help people.
Thank you, Leah, and thank you everyone who's joined. I'm really excited to be here. As Leah said, my name is Sierra Pierce. I use she and they pronouns. I'm the intake manager at Cobalt Abortion Fund. We are just one department of a larger organization that is Cobalt. As Leah mentioned, we also do policy and advocacy work. I don't think I specified this. I've been with Cobalt for about 1.5 years now. Our abortion fund is both an abortion fund and a practical support organization. So the term abortion fund typically refers to funds that provide funding for the appointment itself, so someone's actual procedure or medication abortion. We do that as well as provide practical support. So that's kind of anything other than the abortion, but something someone needs to get to their appointment. So rides to and from the appointment, childcare while someone is away. If they are traveling from out of state, which the large majority of people accessing practical support through us are, we provide flights, gas reimbursement, hotel stays, essentially anything that will reduce someone's barrier to get to Colorado. We have partner clinics that we work with in Colorado and New Mexico. So we specifically support seekers who are going to one of our partner clinics. And we have no requirements or limitations for who we support nothing based on like income, age, state residency, gestational age, immigration status, just because we know that marginalized communities are the most disproportionately impacted by abortion bans. So essentially, if someone lets us know that they need support, we ask what support they need and do our best to fill in those gaps without requirements or restrictions.
Thank you, Sierra. I'm going to move to Kelsey now because she's next in the alphabet from Planned Parenthood. Can you tell us how your PSO functions through Planned Parenthood?
Yes, thank you so much. Hi, everyone. My name is Kelsey. I use she, her pronouns. I'm the manager of patient navigation. So much like Sierra said, we are one part of a many-faceted machine, I guess, if you will. Planned Parenthood obviously is a abortion provider, but also a provider of many, many other reproductive health services as well, including contraception, STI treatment and testing, gender affirming care, and the like. And so the patient navigation program is probably one of the newest departments at Planned Parenthood Rocky Mountains. It started in September of 2021, which was right when SB 8, the first Texas abortion restriction law, was passed, because we knew that if people were going to struggle to get abortion care in Texas, they were going to be coming into our region for care. So we have health centers in both Colorado and New Mexico. And so we have Texas is our biggest traveling where people are traveling from, but they're also coming from all sorts of other places as well. And honestly, we're similar to what Cobalt does. So our program does the same thing. So we provide practical support for flights, gas, childcare, food. On top of that, we also help patients finance their actual abortion as well. So that could be helping them set up a payment plan that's a little bit more feasible for them, with no interest. But we also have grants that we can use to help cover the cost of their abortions as well. So the funding that we use is from some donor grants that are from like a large donor, and those are actually, they do have income requirements, and so they can't be the only thing we use, because as Sierra said, not, people with all kinds of resources need this care. And so we also have internal funds that are pretty much all donations that we're able to use to help patients access care as well. But in order to make sure that those funds kind of reach everyone and that we can service everyone we can, we work extremely closely with Cobalt and Colorado Doula Project and Gloria and a lot of other independent abortion funds that help us fund those trips. So I mean, my team is back and forth with Sierra like literally all day, every day, co-navigating patients to get into our region for care. So we depend on them greatly.
Thank you, Kelsey. And now everybody knows I don't know my alphabet, because now I'm going to go back to Gina, who actually was next. And Gina is from the Colorado Doula Project. So sorry about that, Gina.
Problem.
So tell us a little bit about Colorado Doula Project and how, if it, at all, it differs from what Planned Parenthood and Cobalt are doing.
Yeah, I mean, that's a question that I get a lot. And I think one of the really amazing things that you're seeing here on this panel is how familiar we all are with each other and how closely we all work with each other. And, part of the reason for that is because we are often very frequently supporting the same people. And because in order to provide someone with as complete a picture of the care that they need, one organization really can't do that. In my opinion, we really need these different organizations with different strengths, different availability on a certain day. And so that's something that I noticed when we first started really offering practical support in Colorado, is how much that web of care it's something that's really beautiful to me when somebody is traveling across the country. There are people that, they may never talk to that care about getting them where they need to be safely. And I think that that's something really, really beautiful about the work that we do. So we are also an abortion fund and practical support organization. And, I have to say, I think we all have like a little bit of differences. Gloria has a real specialty in what they do. But one of the things that sets us apart, I think, is our really healthy group of volunteers. So one of the things that we did early on is we developed our abortion doula training. That's something that has changed a lot and been updated and fleshed out in the last 6 years since we first held our first one. So we have probably almost 200 trained volunteers right at the moment. And they do all sorts of things. One of the biggest requests that we get, aside from financial support, which would be the biggest, is rides. People need rides to get to their appointment, to get picked up from the airport, to get back to their hotel, to pick up prescriptions, kind of you name it. And that's one of the things that our volunteers do on a daily basis. Another thing is virtual support. We have a branch of volunteers who you can do either, you can do both once you're trained and onboarded with us. But, a lot of times people, they want to know that there's somebody there. They may or may not want to get into a lengthy conversation with them, but having somebody available over text can be really comforting. And our doulas are really amazing people, and provide a lot of support to people who are feeling nervous, or and also, like, it can be a really good thing to remind them about, like, remember, the clinic has this hotline for you. This is where you call if you have this question, if you're really worried. And they really play an important role. I think a lot of us are used to having someone, maybe we've been to a medical appointment alone, and it's really hard to remember everything, even just on a regular appointment. So I think some of our doulas fill a little bit of that role, with people just reminding them of the resources that the clinic has given them. So, I really love our volunteers. We have amazing volunteers, and they'll always be like, okay, I took client H out to dinner. She seemed really down, and keeping them company, that kind of thing. So it can look like a lot of different things. So yeah, but we are working with everyone on this panel really every day, and relying on each other and trusting in each other. I think all of us here really trust the care that we are all giving to our clients, and I think all of us together make something really comprehensive and powerful for abortion seekers in Colorado.
Thank you, Gina. That's really great to know. And next is Toshika with her innovative program that she's co-founded to make abortion care more accessible to folks. So tell us a little bit about with Gloria.
Yeah, thanks, Leah. I'm Toshiko, she, her pronouns. I'm the co-founder of Gloria, and our project is a nonprofit organization that spans Colorado and New Mexico at the moment, and we connect abortion travelers with free in-kind lodging. So think of vacant Airbnbs. They sit vacant on a Monday and a Tuesday night, while an abortion seeker can utilize that lodging for their appointment. And our goal is really to build a grassroots community that utilizes in-kind resources in order to create kind of a more sustainable and scalable platform. We know that the call to action so often is, mail a check or show up at the polls to vote. And for us, we feel like there's so many more resources that supporters in our community have to offer. And there just hasn't been a really great way to centralize and distribute those. And so that's our purpose. We are kind of the little sister in the room. We are a little newer, but we're really lucky because we get referrals from all of the partners here on the call. So what will happen is a patient will get referred to us from one of these support organizations, and then we will, through our platform, we have a connection in with the calendars of all of our Airbnb hosts who've kind of raised their hand to say, I want to donate a night a month, a night every 6 months, however frequently they do or don't want to donate, we will accept that. So we'll then connect them with a rental unit. We get the patient and the host connected with Gloria, the three of us, and then we kind of function a little bit like a scaled down version of Airbnb after that. So then we send the patient all the details on like your check-in instructions and where you can park and any special instructions on how to find the unit or what to do when you leave, etc. So our goal is really to help take some of the financial strain off of these other abortion funds and practical support organizations by utilizing kind of the resources already out there in our community.
It's so awesome. How long have you been in operation?
Yeah, so we've been around since 2023. Last year is when we really scaled up and started our lodging pilot. So we so far have done 79 nights of donated lodging that's valued at a little over $12,000. And we do that in Denver and in Albuquerque. And kind of like everyone else here has mentioned, the kind of travel from Texas. We get a lot of folks driving or flying into Denver and then Albuquerque, of course, too. So we have a lot of partners and hosts in Albuquerque as well.
Okay, great, thank you. So when I talked to you earlier, you talked about there's an app. Is that how people access everything, or how does?
Yeah, so at the moment, our app, so what we found is that there really wasn't a way for us to easily coordinate kind of lodging availability with the folks who needed it. So we actually built our own app from the ground up, and some of our volunteer engineers are on the call, which is awesome to see. But they've been at it for 2 years now, like building this app that right now is being utilized internally, but it allows us essentially to see really clearly where there's availability across all of our cities and to be able to then assign a patient to lodging there. And then we have functionality that we're building over time so that we can communicate over Signal, which is a secure end-to-end messaging platform that allows us then to message with the patient. We currently use this with all the practical support orgs, and our philosophy is to try to leave as little of a paper trail as possible. So we auto destruct all of our data as soon as the patient is safely back in their home state, and we actually don't have any need to record their last names. We really don't collect much information from them other than what do you want to be called, and we tell them to use a pseudonym, and we try really hard to, as much as possible, not ask any questions and not leave any kind of subpoenaable data behind.
Yeah, that is great. That is just awesome. And I'm taking this, everybody here is a volunteer that's doing this work, right?
That's right. And to Joanna's question in the chat, yes, so our Airbnb hosts, they actually take on the cleaning fee themselves. So many of them clean their units themselves if it's like let's say an apartment above their garage that they'll rent out. And then some of them actually have a cleaning service that comes, and the host will cover the cost of that cleaning service themselves because they're passionate about offering support. And so most of the time, our hosts and our patients never meet. Most of the time, it's only through Signal that they use each other's pseudonyms, but it's been really beautiful to see the way that it creates a community. Like Gina was saying, so many patients may not have told anyone else that they're traveling out of state, that they're pregnant even. They're isolated and stigmatized feeling often. And so now they have this little community with a host that's kind of welcoming them into their home and their space. And it's been really lovely to see how those patients just feel really supported, and our hosts, even though it costs them something, they feel a real sense of reward doing that.
Oh, okay, great. Thank you so much. That is so interesting. I'm so glad to see this. Oh, I had one other question that other people are probably thinking about. Do you accept people who are not Airbnb folks as part of the program? Because I know at one time we may have been able to do that in this state, but then with COVID and other things that came along, we got out of doing that. We just did not use people's private homes.
Mhm.
But can you do that through Gloria?
It's a great question, and there's a lot of hosts who have spare guest bedrooms. How many of us have a spare guest bedroom that we would love to offer up when we can? At the moment, we just finished our pilot with short-term rentals, and it's important for us to currently have a space that's private with their own entrance for patients to have that kind of security and privacy. But it is on our radar of like, how can we offer guest bedrooms as spaces? How can we do it safely and securely? And we haven't cracked that code yet, but we're working on it. So, so yes, we actually have a form on our website for folks who are interested in that, and I think we have 60 folks on that waiting list from I think 15 different states across the country already who want to offer up their guest spaces. So we're working on it.
So you can get on a waiting list if you're interested.
Yeah, if you don't have a space that's kind of private with its own entrance right now, yes, we would love to at least keep everyone posted as we expand into that space.
Okay, great. And it sounds like your plans are to go nationwide with this?
Yeah, that's our hope. You know, we've already had patients from Florida, Oklahoma, Texas, obviously, Georgia, Alabama. So folks are coming from really far distances. In fact, even last week, we had a woman traveling with her husband, her three small children, driving from Texas to Albuquerque, which is, I don't, 15 hours, something crazy like that. And ideally, we would have little pit stops across the country where they can stop and stay the night, and we can kind of shuttle them across the country, as sad as that is. But that is our vision, is to have a nationwide network.
Thank you, thank you. So moving on to our next question, because I could talk about this all night. Um, I want to ask everybody what the challenges are that they're facing right now due to the landscape of or I guess the legal landscape in the United States. And I'll go back and start with Sierra just to find out from her what kind of challenges you're facing.
Yeah. I mean, I think probably the most obvious one is the cost of care and also the cost of travel. Like, flights are more expensive than they used to be, hotel rooms are more expensive. So we're spending a lot more on those things than we used to be. And there's kind of a snowball effect. So after Roe v. Wade was overturned, people did a lot of rage giving. So they were really mad, they donated to abortion funds. Since then, that has slowed down a lot, but the need for funding at abortion funds has not changed. So essentially, other funds around the country don't have enough money or are limiting who they can support. And we're seeing this all the time, that funds are reaching their capacity. So we're getting more and more people in our queue with higher and higher fees and more complicated needs that we are navigating. But even in addition to costs of care and travel going up, some things we've seen a lot more in the past couple of years are just more complicated cases, like people traveling from really rural places. They can't get to an airport. They don't have a car. People traveling without IDs. Something we're anticipating is on May 7th, TSA is implementing you must have a real ID to fly. 44% of Americans do not have real IDs. So there's a very real chance we have clients show up at the airport in the next week or two and maybe don't get through TSA without a real ID and don't make it on the plane to access their abortion. So just lots of tricky, complex landscapes that we are currently navigating, both with funding and legally. And then the other thing that Cobalt has been doing a lot of is considering our data and digital security in an ever-changing digital world where we do a lot on our phones and it's easy to potentially track us and read our messages. We are constantly making note of what our digital security looks like and how we can make it even safer for our clients and ourselves to provide this support.
Okay, great. Thank you so much, Sierra. Now I'm going to go back to Gina and ask her if you have anything to add.
Yeah, sorry, I have to keep muting because I have a puppy that is learning to alert me when anybody walks near my building at all. So I mean, one of the things that I immediately thought of is just uncertainty. A lot of the things, I think probably something that has been effective with this administration is just not knowing what's coming, not knowing when it's going to come, not knowing what shape it's going to take. It is harder to plan when you don't know specifically what is coming, either legislatively or with an executive order or something like that. So I know for myself in my role that uncertainty is something that really keeps me up at night. And probably everybody's going to say it here, but I think it's really important to talk about is that one thing that I've heard lately from people is you know um like they want to do more than just donate, right? I want to do more. And I know I know where that's coming from, and for instance, we do have places for people to volunteer and things like that. But donating does a lot. People cannot get their abortion without money. They cannot get on a plane without the money to buy that ticket. And donations do a tremendous amount. And everybody here, like I said, I think it's really great to work in a field where we are not pitted against each other, because we are working with the same people so often. But I know that Colorado Doula Project had to shut down in, gosh, I can't remember if it was January or February, but for the first time because of budget, our budget just dried up. And that is terrible because, the stakes are high. And when somebody doesn't get that care, that can change the trajectory of their life. That is not a small thing. So, for people who are, maybe feeling like, oh, donating is like blah, blah, it is huge. It is really, really huge. And I also know that all of us here are excellent stewards of people's money and really doing amazing things with it and really making it go the farthest that it can. So yeah, I budget concerns are a constant thing for us. Um, and I could kind of go on and on about the challenges and the things that are amazing about this work, but I'm gonna cut it off there.
All right, thank you, Gina. Moving to you, Kelsey. Do you have anything to add? And I do have a question for you.
Yeah, I mean, you
I
want to just jump into that?
I know that there are a fair number of Planned Parenthood clinics in Colorado and New Mexico, but not all of them offer abortion care. Where does a person go if they're from, say, Yuma, Colorado, to access abortion care?
Yeah. It's a good question. So I do have just a quick tidbit to add on what Sierra and Gina were saying, and then I can answer that. But just to echo what both of them said, one thing that, and I've shared this with both of them, because back in November, PPRM had to kind of reconfigure how we were spending our internal patient assistance funding, which is all donations, because it's a pool that we spend not just for abortion patients. Our patients that are getting IUDs and hormone therapy, whatever, also need financial assistance often. And so a really interesting statistic was that in before Roe fell, so the year before Roe fell, PPRM spent about $1 million on patient assistance funding. Toshiko, I'm allowed to say this, right? Okay. I'm like, am I about to like share a secret? Okay. And then in the year after, so Roe fell in June of 22. And then in that the whole year, from that fall to the following, we spent 10 million on patient assistance funding, which is hilarious. And so yeah, same issues, budget issues, our volume is just wild. And so we had to kind of scale back how much we were spending internally because we weren't going to be able to keep that up, right? Like our donations weren't coming in fast enough. And so a challenge is just kind of adjusting, but what's really encouraging is that we made that adjustment this past November, and I kind of rallied all our partners. So Colorado Doula Project, Cobalt, Gloria, and then we have a bunch of Texas abortion funds that we work with and from other states as well. And I kind of met with all of them individually and was like, listen, we are committed to making sure everyone still gets what they need, but we have to scale back how we spend it, how we spend our funds. And I mean, everyone really just rose to the occasion, and it's hard on everyone, right? Like we were asking so much more than we used to from these funds. But what's so great is it's kind of like this, our navigators have become so much more sophisticated in how they navigate because it's like a puzzle piece, like everything's a puzzle piece. And so we're spending way more time on navigating each patient. But I also think patients are getting better care. And one statistic that proves that to me is that so for an out-of-state patient that makes an appointment with Planned Parenthood Rocky Mountains, if they have an out-of-state address and they make an abortion appointment with Rocky Mountains, the average no-show rate is 29%. If that same population speaks to and like works with one of the PPRM navigators, that drops to about 7% on average. Before November, our no-show rate was like, it hovered between like 9 and 11%. And then we kind of made that adjustment, and then like our no-show rate dropped to like 5 to 7%. And so I think like the change actually propelled us into doing better and reaching more people and actually giving people everything they need with the help of each other, which is so cool. Okay, so I just wanted to throw that out there. And then your question was about, so we have about, I think it's 18 health centers in Colorado and 5 in New Mexico right now. And we do have some in more rural places, but yeah, like you said, Leah, it's not always feasible. We have recently expanded greatly our telehealth abortion access. So we have every day we have telehealth medication abortion appointments where you can make an appointment, you do your meeting with your provider, and then the pills get mailed to you. And we even have people who travel who will drive across the border, pick up the meds, and then they're good, right? And do their telehealth appointment, so they don't have to actually go all the way to Albuquerque or what have you. So the telehealth has been a huge help with that. We also have independent abortion providers that we, if we need to, will refer to. Our providers are really well connected with each other. Like we don't really, we're not proprietary in this, like there's enough people who need abortions. I don't think we necessarily compete with indie providers. We want people to get what they need. So we have pretty close relationships with indie providers as well. And all of our, in Colorado at least, all of our health centers do provide abortions except one, because they focus on gender affirming care. But not all of them do procedural abortions. All of them do medication abortions. And then we only have 3 right now that do procedural, which is just a bigger undertaking. But yeah.
Okay, great. Thank you so much. Truly interesting. And I think we've kind of covered a little bit. My next question for everybody was, how do we out here in the public support you all? And I just want to give my little 2 cents worth. You know, in this day and age, what we're facing in this country is, you know, for my 71 years, not something I've ever seen before, although certainly was predictable, but I feel pulled in a lot of different directions. You know, I'm an avid environmentalist. I'm a, you know, abortion rights activist. That's, you know, kind of, I'm, you know, would love to support people who have immigration issues and that kind of things. So for me, the way I make those decisions about who am I going to support with money, time, and effort, I look at what meets my deepest values. And also for me, it's way more important for me to know that my efforts and my money actually go directly to people that need the help. So if that helps you make a decision, go with that, because it has really helped me clarify things in my own mind about, okay, there's a million things I could be doing. I could be down at the Capitol right now marching, but, and that's important, really important. But this I know is eventually going to trickle down and help some individual person. And that's how I wanted to do it. Also, our fearless leader, our CEO of the League of Women Voters Colorado, said something in a Zoom call I was on a week or two ago, where people were saying, how do we help? What do we do? You know, and she said, always remember that resistance and fighting against tyranny does not have to be a big public deal. There's a million different ways you can be a resistor and part of the resistance movement and never show your face anywhere. And this is something I've really taken to heart and think about, because I'm not a big marcher. I'm, you know, that's just not my thing. But doing something like this is my thing. Honestly, writing a check is resistance. And she said the biggest thing that defeats tyranny is love and compassion and caring about other people. So if what you're doing is taking care of other people, you are a resistance fighter. And I have really, like I said, taken that to heart. And I urge everybody else to take that to heart when they're thinking about what's going on. When you actually know you're helping an individual who is being oppressed, then you are really fighting the war, and you're fighting a good fight. So my 2 cents worth. Now we're going to move back to Sierra and see if she has anything to say about how we all out here can support you guys. What can we do to support you, in addition to writing the checks? I mean, I know that's really super important, but are there other things that help?
Yeah, definitely. We get this question a lot. And I think a big thing that people tend to overlook is just share our information, follow us on Facebook, Instagram, Threads, tell people in your life, tell people in your community about Cobalt, because when it spreads via word of mouth or communities, that just gets more and more people involved. So just as much as saying to your friend, hey, have you heard of Cobalt? Hey, have you heard of Gloria? Is so huge in order for us to get supporters in growth. We have I'll drop it in the chat. We have a Get Involved page. So we don't have a large volunteer cohort right now because we don't have consistent need for that, but we share when we have events, fundraisers, partnership opportunities. Folks can host a house party to host a fundraiser, but then you are not, you're not responsible for donating, you're hosting in your home, and people in your life might want to come in to donate. So that's listed on that page. But mostly sharing, talking to people, next time an election rolls around, talk to 5 people in your life. Talk to a few people about Cobalt. If you ever get your hands on some of our stickers, which we tend to give out at events, put them in public bathroom stalls so that people know where they can get abortions. Just little things to spread the word. And I'll drop our Get Involved page in the chat so people
Great.
can go to that.
Thank you. Thank you. Okay, Gina, anything to add to?
Yeah, I want to make sure everybody gets time to add something. I will say one great way is to take our abortion doula training. Anybody can take it. It is go at your own pace. It's suggested donation. No one turned away for inability to pay. I really like to push this training as a community resource. It is a requirement if you're going to volunteer with us, but anyone can take it. And we need more people who have a good foundational knowledge about abortion and reproductive justice. We need those people in the community, at dinner parties, at barbecues. Summer's coming up, social events are coming up. So again, sort of similar to what Sierra was saying, like being able to talk about these things. And I would also ask people, and I'm thinking really offline here, when you have the chance uh, to make a choice to engage a little bit, if you hear somebody spreading misinformation, or asking one of those old questions about, like, oh well, I support abortion but I don't like when people use it as birth control. It really helps to be able to have a well-informed group of people who are ready to take those questions on, and I think our doula training is a great way to do that. I'm gonna let's see. I'm going to drop that link in here. And also, I'm going to put in my email. Please feel free to email me with any questions or, thoughts or concerns. I love to hear them. I love to yap. So definitely reach out to me.
Thank you, Gina. Kelsey, anything to add to what we've talked about?
To be completely honest with you, whenever anyone asks me how they can support individually, I send them straight to the Colorado Doula Project and Cobalt websites because I think that they're the best ones to get connected to do something as an individual. So I'm going to defer to them.
All right, awesome. Toshiko, anything to add?
Yeah, I'll say, like you heard, the typical donate, obviously, connect. For us, being a connector, and I think I said this to you, Leah, on the phone, is like, sometimes that's your superpower, is connecting people. It's spreading the word about Gloria. We had, for example, we work with a Episcopal church in New Mexico, and they were actually previously functioning as the address where folks coming out of ICE detention centers were being dropped off. And then the city of Albuquerque turned a program that then was more formalized, and they didn't need the church anymore. And now the church is pivoting to helping with folks traveling for abortion care. They have their own little space, and it's beautiful. And we would have never known about it if it hadn't been for one of our lodging hosts sending an email to just connect us. And so for us, getting the word out, we really we know that there's a ton. In fact, when we first connected with Cobalt, I said, please don't send me every patient, because we will never have enough inventory for that. But I have the hope that someday maybe we would. Someday maybe we'd have enough inventory that these groups, these partner organizations, have to spend much, much less on hotels every single month, and that we can take some of that burden. So we would love if you have professional newsletters, professional organizations that you're a part of, or like Kimberly was saying, your First Unitarian Church, if you have a church newsletter that can go out and that can just be a small like image or blurb about any of these organizations. For us, we're really looking for more hosts to join. And then, of course, if you have so many of us are professionals, maybe you're an expert in developing websites, maybe you're a CPA, maybe you are a social media influencer, whatever it is, those professional skills are really helpful, especially for organizations like ours that are so small and we're still totally volunteer led. So we rely on those professional services. And so it's so much more meaningful to donate that type than to come and like stuff envelopes that we're going to send out. Like send us the things you've spent your whole life curating expertise in. We can use that too. So really any of those, donate, connect, and host for Gloria. Those are the big ones.
Thank you so much. Well, it is 6:28, but I still want to take a few questions. Leslie is my chat monitor. Do you have some questions in there that we can share with the whole group and throw out?
I think there was a question about the amount of need, and are the services matching the need that's out there? Or where are services being, maybe cut back or dropped off, or how is that connection really close?
I mean, quickly, I know that we are not reaching everybody in rural areas. I think everybody here can say that. Like, the ability to reach people in places in Colorado where it's more difficult, transportation is more difficult, that kind of thing. That's something that I hope we can work on. And and I think we've had to close, um, you know, before, and we haven't had to turn specific people away necessarily. But yeah, I mean, for us, our monthly budget right now is about 25K a month for our clients, and we could easily do 30, 35, something like that, in order to really take care of more people more completely, and also like spread the load between our partner organizations who are all here.
Anybody else have anything they wanted to add? I think Sierra, you wanted to add something.
Yeah, I spoke to this a little in the chat, but I want to clarify. In terms of folks that reach out to Cobalt, I would say the majority of them we are providing funding to and care. In 2025, I can say 100% we have not turned away a Colorado resident or anyone traveling to Colorado, so long as, for the most part, they're going to one of our partner clinics. We do fund in New Mexico, and our funding's a bit more limited there. So sometimes we are sending emails to those people, letting them know we cannot help them. Luckily, so far this year, that has not been due to funding capacity. That has been due to, like, we don't have time. We don't have the people time. What I will say so folks even in Colorado who reach out to us, a lot of times these gaps are so large and complex that we loop in multiple funds. So Cobalt helps with some of it, CDP helps with some of it, a Texas fund helps with some of it. So Kimberly, hopefully this will kind of help with your question. If we were to provide 100% assistance to everyone rather than looping in additional funds, we would probably spend twice as much money. So it's not that we're turning away half of people. We are getting those gaps closed. We just aren't doing it entirely. We're working with other funds. But I don't have statistics. I don't quite know, because the amount of people we turn away varies. It is a slim amount, but we are getting a lot more funds involved now to close gaps, whereas it used to be Cobalt was able to cover everything that a seeker needed, and currently that is not always the case.
And I just wanted to throw in a statistic that I didn't talk about earlier. I went to the Colorado Department of Health and Environment's website, where they have 2023's numbers on abortions in Colorado. And there were over 16,000, somewhere between 16 and 17,000. I don't remember the exact number, but I do remember that 29% of those were for out-of-state patients. So that is almost a third of the abortions performed in Colorado are coming from out of state, which just increases the cost and increases the burden on everybody, the PSOs and the patients, obviously. So it is a big deal that we're dealing with, and I'm so glad to hear that there's a Texas fund that is helping out with some money, because they really need to. So just, bear that in mind, that Colorado, we're lucky we've got the great laws we have and the great protections we have, but it brings an added responsibility to us, and an added duty, I think, to us as well, to deal with that. And in terms of how can we support, the reason the whole Reproductive Freedom Task Force was started several years ago was to start a program to destigmatize and educate about abortion. This was before Roe v. Wade was overturned, or right adjacent in there. I wasn't here or part of it at the time, but that was the reason it got started. And I think that's one of the most important things we can do, is talk about abortion in a way that educates and also destigmatizes it. Because from what I can tell, just talking to even friends of mine, destigmatizing it is critical to getting their support and understanding, because we've all been fed all the lies all our lives. And it's really important to fight back against that whole mythology. It's going to be even more important now. Probably Kelsey knows this, but the House of Representatives leader, what is his name, Mike Johnson, announced today he's formally going after Planned Parenthood's funding. So there you go. That's the next fight.
Don't worry, we're gonna be okay in this
Yeah, I know you're
affiliate.
going to be okay. You're going to have them.
We PPRM divested from federal funding in like the 90s, so we're chill.
Yeah. And also, I don't know about all of the other people on this call, but I have found that people who are members of the League of Women Voters, when they get going, they're fierce. And you do not want to get on their wrong side. So that's the other thing that I'm trying to do, is stir that up a little bit with a lot of people outside of the league, get them to come to the league, join my task force, or our task force. I have so much ownership of it. Because we're going to fight this fight, and we're going to do it in a lot of different ways. And we're going to have fun while we're doing it too. So any other questions that we've got from folks?
No, most of it was about the gaps in care. There's one detail I'd like to ask, because there's another gap in care with Dr. Warren Hearn closing his clinic up in Boulder, and he did, well, I mean, one of the specialties up there was the late in pregnancy terminations. And so what happens with clients who need that care? Are we seeing a drop off in care providers?
Yeah, I don't know. Toshiko might be able to speak to this a little bit too, but just because she's been around a little bit longer than me. But I know, so our chief medical officer works really closely with the Boulder Clinic, and also Southwestern Women's in New Mexico, and there's a couple others, university hospitals and whatnot, that she'll refer to if needed, if there's like some sort of complication that someone needs to be transferred for. And so I know that she's watching that and has a contingency plan. So there are other places that will be able to provide third trimester abortions as needed, and they are in other states. So Oregon is one, and DuPont in DC is the other one that I can think of right now. And we already send patients over there when we need to. And that's just something, it's just kind of part of the care. Like when we have patients and they're our responsibility, but they need a certain kind of care that we can't provide, we'll get them to where they need to be. So it's hard that that's happening, but it's also I don't think it's going to necessarily break anything, if that makes sense. I don't know. Tashika, did you have something to add?
I was gonna say, I have heard that there's also a large facility opening in Chicago specifically to serve patients like later along as well. And I know just in the last 10 years that even Planned Parenthood has increased the gestational age that they go to in their abortions. So really trying to open access there. But of course, like, yeah, Dr. Hearn has a very unique patient population. But I know there's also, providers in our communities, like the hospital systems, that aren't necessarily known as abortion providers, but they are providing abortions and providing care to their patients as well. So they may not be as known, but they're, I'm optimistic that we will still have places where all these folks can get care.
And Nia asked a follow-up about the closing abortion clinics. How can we support people and organizations out of state? What does that look like as Colorado residents? Would that be funding? Is that a straight up funding?
I would say
support.
An important thing is, when you look at the map, Colorado and New Mexico are in the center of this giant geographic landscape. And for us to protect abortion access in our state is one of the most important things we can do for our border states and our national community, right? So I think we're doing that, and we're doing really phenomenal at that. And so keeping access open for us and for our state allows that, regionally as well. And then, of course, there's always the abortion funds in Texas, like Fund Texas Choice and other groups that are on the ground, and they're much better connected with those communities, and they refer to all of our PSOs as well.
Yeah, and if people want me to send them, I also have a whole slide. I think I've got like 5 slides of resources that are not just Colorado. They're national resources for abortion funding, care, all kinds of stuff. So if you want that resource guide, let me know, and I will be happy to get that to you, because it's, it's got like apiary on there, and just, I can't even name them all off, but there's about 30 different organizations that I can give you the information about.
And I'm going to pop in here and also promote. Leah has in that, when she's talking about the resource, she also has a presentation that she does on the kind of abortion landscape and destigmatizing abortion. So she didn't ask me to do this, but I say, if you have a group, an organization, a church group, a group of friends who want to go deeper, Leah and the Reproductive Freedom Task Force has a presentation that's ready to go, Zoom or in person.
Yeah. And I'm happy to do it anywhere, anytime. I drove up to Greeley on Saturday and did it up there for the League of Women Voters Weld County group. I keep it up to date, so I'm always on top of what's going on, or try to be anyway. And I don't know, how big of an impact it has, but I'm not ever going to stop talking about it. It's it's gonna be talked about at length, by me anyway. So, and I'm happy to do it anywhere. So, any other questions? Well, a big, huge thank you to my panelists, Sierra, Toshiko, Gina, and Kelsey. Thank you so much for being here. I'm gonna let you off the line. I can't tell you how much this means to us that you were here, and thanks to all the people that attended. Go out and spread the word, the good word, because we've got it. And check on the League of Women Voters website if you want to get more involved. It can happen. So
Thank
we
you.
will sign off now, but I'm going to keep Leslie on for 1 minute. Thank you, guys.
Bye. Thank you.
Bye. Great.
I'm going to stop the recording.
Oh, yeah, you can do that.